Hi everybody, it's Dr. Daria here, and today I'm going to do this live. I'm going to do this live video, and this video is about diaphragmatic breathing. So I'm going to talk to you about what diaphragmatic breathing really is, how to do it, and really what not to do. Some of the myths about diaphragmatic breathing and the best ways to do it are commonly used like as a relaxation exercise, or a lot of times in yoga you'll hear about diaphragmatic breathing, but it's often taught, in my opinion, incorrectly and in a way that can actually be more harmful than helpful. So I'm going to show you the best way to do it, and yeah, how you can use it in your life. And this is a little precursor to my upcoming course. It's going to be on Tuesday nights starting September 29th, from 6 p.m. to 7:30 p.m. Mountain Time. And they're just $10 each session. It's 3 sessions, and we'll do some movement type exercises that will be preparing your body for breathing. And then we'll also do some specific breathing exercises, and then a little education at the end. But for today, let's just talk about diaphragmatic breathing. So, first of all, I think it's important to understand a little bit about the shape of your diaphragm and how it works. So, if you can picture your rib cage, which is kind of like this egg-shaped structure, your diaphragm actually makes like a dome within your rib cage, or ideally it should. So if this is your rib cage and this is your diaphragm kind of domes up in there. And when you inhale, it's like a piston, it moves down. And when you exhale, it moves back up. And that's how we ideally want our diaphragm to work. The more we can sustain this dome shape, the better your diaphragm will function, the more you will be able to efficiently pump air in and out of your lungs, and the more you'll be able to circulate that oxygenated, fresh air to your body so that you can move toxins out, you can feel more energized because you're getting more oxygen to your body, and you can actually really develop in your fitness and your efficiency of using your diaphragm. So the problem happens when we have our diaphragm becoming too flat as our ribs kind of flare out in the front. So, as an attempt to get more air in, we'll kind of use our neck muscles to pull our ribs up in the front, which ends up making our ribs kind of flare up and flattens out our diaphragm. So instead of having that nice dome, you end up kind of pulling it flat. Now you can't have that nice pistoning action, and it ends up just having to be a lifting of your ribs to breathe each time. And obviously, nobody breathes like this, it's happening on a subtler level. So that's what we want to avoid. We want to restore proper diaphragmatic breathing, which is more like a piston, in and out, like that. So, how would you do that? The best way to do it is to focus on getting all of your air out, because as you get your air out, you're able to restore the ribs coming down, which will help restore that dome shape of the diaphragm. So, a lot of people think about breathing, you think about inhaling, but it's really important to focus on exhaling for diaphragmatic breathing. So, the way that I often teach most of my patients to do this is you put your hands on your lower front ribs. So, right here, kind of not, if your belly's under here, it's kind of that squishy part. You're right on those ribs, that more firm rib cage, bony part. You're going to breathe in through your nose and then do a big sigh out through your mouth. Exhaling, exhaling, exhaling all the way out, and you're going to pause at the bottom and then try and keep those ribs down as you quietly breathe in through your nose. So you would repeat that, and the key is you have to get all your air out, but if you are in a pattern of pulling your ribs up to breathe in, it's likely that you're actually not getting all your air out. So when you feel like you've exhaled completely, usually there's a little more air in there. So it's better to just keep exhaling until you feel like you really can't anymore. So it might look like this. You breathe in through your nose, big sigh, and you might feel like you're done, but maybe you just check and see, oh, there was still a little more in there. And then that little pause at the bottom, and you wait for that feeling of needing to inhale. That will also trigger the part of your brain that manages breathing to restore a normal diaphragmatic breath. So let's just do about 3 cycles of breath together so you can see and feel what this feels like. I also recommend not sitting up too straight, just let yourself kind of slump and lean back a little bit into your chair. That actually helps promote the ribs down. So, not slumping like this, obviously, but just kind of a more relaxed posture, maybe supported by the chair if you can. And we're going to do 3 breaths together. So here we go. Breathe in through your nose. Hands on your ribs, blow out through your mouth. All the way, all the way, all the way out. Pause there. Now quietly breathe in through your nose, trying to keep those ribs relatively down. And again, blow out. All the way out. Pausing. Breathing in. And you might feel your back ribs expand into the chair as you breathe in. One more breath, blow out. All the way out, pause. Quietly breathing in. And relax. So that's a very simple but powerful technique for restoring normal breathing. And right now, if you're not used to doing this, you might feel like it's hard to hold your breath at the bottom, and that's okay. You can just hold it for like a second or two. And over time, you'll be able to increase that hold time to about 4 to 5 seconds, which is ideal. So why would you want to learn how to do that? Well, if you can restore that dome shape of your diaphragm coming up inside your rib cage, you're going to have a nice, almost like ball and socket joint to rotate about. So you can rotate your trunk really nicely around that nice dome diaphragm. Whereas if your diaphragm gets kind of flat and you don't breathe with your diaphragm, you just breathe with your neck muscles pulling your rib up, your rib cage up, then you can't really rotate well, and you end up rotating at joints that aren't meant to do that much rotation. So for example, if your rib cage doesn't rotate well, you might do a weird torque in your shoulder, and then you end up with shoulder issues, or you might end up torquing your hips or your knees, joints that aren't supposed to do all that rotation that's meant to come from your trunk. Another thing that I kind of alluded to before is our body needs to use oxygen efficiently, which means that it needs to get as much oxygen to the tissues as possible. If we're not pumping that air completely out with that piston action, and we're just kind of, getting that little bit of air in and a little bit of air out, then that means there's a lot of stagnant air in the lungs. It's not getting all pumped out. So if you think of your lungs like a container, when you breathe in, you get a certain amount of air in, and then you exhale, you push that air out so you can get fresh new air in. However, if you're not breathing properly with your diaphragm, if you're not getting that piston pushing up under ribs that are down, you're not going to get all your air out. So instead, if you think of that container again, you breathe in, it fills with air, and then you exhale, but you don't get all that air out. You're only going to have this much room to breathe in again, and you don't get all that air out. And you end up with less and less room to breathe with a lot more stagnant air. So obviously then your body can't access new oxygen fresh oxygen from your environment if you only have this much room in your container to bring that fresh air in. So it's really important to get that complete exhale, to get that nice doming and ascending of your diaphragm, which happens when your ribs come down in the front. So we went over what diaphragmatic breathing is, why it helps, how to do it, and now I want to talk a little bit about a lot of things that I've heard about diaphragmatic breathing just from, I don't know, taking different meditation classes or yoga classes or just stuff online, or a lot of books talk about diaphragmatic breathing, and then they tell you to put your hands on your belly and kind of breathe in and push your belly out and exhale, feel your belly fall, which can be relaxing if you are in a stress state and you haven't taken a deep breath. But I find that people who have been taught to breathe that way have a lot more difficulty and issues associated with that, and we kind of have to train them out of that. The reason doing that belly breathing, like pushing your belly out on the inhale and bringing it back in on the exhale, is problematic, well, there's a few reasons it's problematic. The primary reason I find it problematic is you're basically training yourself to not move your rib cage when you breathe. Because what's happening there is, if this is your rib cage and this is your diaphragm, and then this is all your guts underneath, when you poof your belly out like that, you're basically keeping your rib cage stiff, your diaphragm's flattening out, which kind of pushes your guts out. And that's what you're feeling when your belly poofs out. So you're teaching your diaphragm to go flat without moving your rib cage. And that's really aberrant. It's problematic for the reasons we discussed earlier. You're not maintaining that dome and getting that piston action, so it's not promoting rotation. But a stiff rib cage is very limiting because it doesn't let you get air in properly. It doesn't let the structures that attach to the rib cage move well. It doesn't let your body pump all the pumps that it needs to, the lymphatic pump, the breathing pump, the blood pump. We want rib cages that move. We humans are human beings that we aren't stagnant creatures. We don't just stay in one position. Even if you feel like you sit for an hour, think how many times you shift and make little micro movements in that hour. We're not meant to be really firm or unmoving. So that rib cage is the center of your body, and it needs to be really pliable and fluid and mobile. So you would never want to train yourself to breathe without moving your rib cage, which is what that belly breathing is essentially doing. It's also teaching you, instead of maintaining that dome of your diaphragm, to flatten and unflatten your diaphragm, which, for the reasons we talked about before, is undesirable. It's not going to allow you to move all your air out, and it's going to keep a stiffer rib cage. The other issue with this kind of breathing is that it does not allow for abdominal cocontraction upon inhalation. That's the technical term. Basically, what that means is you cannot maintain your abdominal muscles on. They can't be active and on when you inhale if you're doing that kind of belly breathing, of poofing out your belly to breathe in and exhaling to let it come back. So the reason that's important is your abdominal muscles are key stabilizers of your body. And one of the primary reasons that people develop shoulder issues is a lack of abdominal cocontraction upon inhalation. Basically, with every breath, you're losing stability. And our shoulders are attached to a shoulder blade, which is attached to a rib cage. And the shoulder is a very dynamic structure. Literally, the only place that's bony, where your shoulder attaches to the rest of your body via your scapula, is a joint that's like this, like two fingers coming together, the AC joint. And then the shoulder blade it's just a floating bone. It just floats on your rib cage. It's just attached by muscle. So if you don't have that stability from your core to stabilize that base, your shoulder is going to have to do something wonky just to be able to do its job of being a shoulder. But not only that, just when you're doing your life, you want your abdominals to be able to function and not necessarily really tense, but they're more also fluid, kind of contracting and moving in all different ways. So even when you're just up and about walking, you want a little bit of abdominal co-contraction. Even as I sit here, my abdominals are working a little bit to hold me upright. Now, if I was practicing belly breathing where I was poofing out my belly with every breath, I would lose that stability, and then you develop all kinds of other issues that can range from back pain, hip pain, like we talked about shoulder pain, or you know, anything to do with your spine and your back. So, to summarize, diaphragmatic breathing essentially means being able to maintain the dome of the diaphragm within the rib cage. That means the lower front ribs must move down and in upon exhalation and stay relatively down and in upon inhalation. Secondly, this is an important thing to do because it's going to allow for moving as much air as possible out so that you can bring fresh new air in so that you can oxygenate your body. Thirdly, the way to do this is to breathe in quietly, fully through your nose. Blow out through your mouth, feeling your lower ribs move down and in, all the way to the bottom of your breath. Pause there, then quietly breathe in through your nose. The way not to do this is to poof out your belly as you breathe in and bring your belly back in as you breathe out. That creates aberrant movement patterns. It teaches you to keep your rib cage stiff instead of pliable, and it teaches you to turn off your abs every time you take a breath, which is undesirable. So I hope you guys found this helpful, and feel free to reach out to me. You can send me a message on Facebook, or you can check out my website. There's a place to contact me there. My website is myessentialpt.com. And if you haven't already, make sure you sign up for the 3-part course on Breathe Better to Move Better. First session is September 29th, 6 p.m. Mountain Time, and the sessions are just $10 each, and you can sign up on my website, and I'll put a link up on Facebook as well. So thank you again for tuning in. Have a great day. Bye.